my name is Sibyl. I'm a speech pathologist, and I'm helping with the training of the Nursing Bedside Swallow Screen. First of all, we need to make sure we have all the things we need to do this screen. We need drapes, 2 of them. We need a teaspoon of water, 30 cc's of water, and 60 cc's of water, and have a thing of water also extra. And we need a kidney basin. We need tongue depressors or lemon swabs to check the gag reflex, preferably the tongue depressor because we have those more in supply. We need gloves. And in order for the patient to be sitting in the 90-degree position, which is very important, because if we're sitting way back, gravity can work against us and make us choke. So the beds don't always go up. Sometimes the pillows do work. It may be better to use the bolster to make somebody be in the correct position at 90 degrees. And now we'll go to the pre-swallow screen assessment, where we're going to ask the patient, find out his alertness level. So tell me your name.
John Doe.
And how about your birthday?
March 15th, 1960.
And that corresponds to his wrist thing. And now would you would you count to 5 for me?
1, 2, 3, 4, 5.
And his speech is very clear. There's no dysarthria there. And he did answer that question well. And so would you clench your teeth like this? Good. And close your lips. And I want you to go like this. And he's nice and symmetrical. He doesn't have any weakness from one side to the other. And would you stick out your tongue right out front? And now his tongue is sticking right out front. He's not deviating to the left or the right. And we're going to check his uvula. So we're going to open up this and see if his uvula is intact and in the midline, and it is. There's no deviation there. And now we're going to check his gag reflex with the tongue depressor. And he had a good reaction. His tongue tube was there. The tongue tube means that you have a gag reflex, and he did cough also. So I think his gag reflex is intact. Now, can you also swallow? Just give me a little swallow. So he does have a laryngeal elevation for his swallow, so that is present. Before we start, we'll just protect the patient with the chucks. We'll put that there. And now we'll look at the actual swallow and see how he does. First, we're going to give him a teaspoon of thin liquid, and he's going to take that himself. He has a good swallow reflex. He doesn't cough, he doesn't choke. And now say, ah. And his voice is nice and clear, it is not gurgly. Next, we'll give him the 30 cc. Nice swallow reflex. He doesn't cough or choke. And say, oh. No gurgly voice. And now we're going to give you the 60 cc, and if you could swallow that in 2 or 3 sips. We have a nice swallow reflex here, and no coughing or choking. And we have a nice clear voice. So to me, this is very encouraging for him to move on to eating and drinking as he pleases, and like that. Now that we've seen all 3 sizes of the swallow without any kind of coughing or choking, this is very encouraging, and the voice was very clear at each swallow, even on the large one. This to me ensures that he is swallowing safely and that he could move on to eating and drinking meals. And now we'll move on to this patient. Tell me your name.
John Doe.
And can you tell me your birthday?
March 15th, 1950.
Very good. And can you count to 5 for me?
1, 2, 3, 4, 5.
So to me, this patient is alert enough to follow some commands. He's definitely got some dysarthria, but it's not enough to stop the eval and wait for 12 hours and start again. So we will go on with this assessment, and we'll protect him with the chucks. And now, can you clench your teeth? It may be a little bit weak, but he's doing it. And close your lips. It's a little bit weak, but he's doing it. And can you go like this? E. And it's symmetrical. And can you stick out your tongue? Okay, it's kind of going to one side, so he may have a little bit of a left-sided thing going on with his tongue. And we'll check the uvula. And yes, his uvula is a little bit going to the left side. So, but it's not enough to stop the evaluation. So we'll go on from here. We'll check his gag reflex. He doesn't have a gag reflex. So that's something to keep in mind. And he didn't cough with the gag reflex. Can you swallow? He has some laryngeal elevation, so I think it's okay to progress on with the rest of the evaluation. And now we're ready to try a teaspoon of thin liquid for this patient. I'm going to give it to him because I think his hands are too weak to handle the cup. So I will give it to him. And he's coughing, and you say, "Oh." Okay, his voice is gurgly, which means the water is on his vocal cords ready to drop into his lungs. And he coughed after his swallow. And I see a little bit of tearing, so it might have already gone in. When we have tearing, that means there could be a silent aspiration, and tearing usually happens after it drops into the trachea. And now that this patient has demonstrated that he is aspirating on the swallow, he should be referred for a swallow evaluation with the speech language pathologist to further assess his swallow.